Hello and welcome to another edition of For the Record. I'm Sean Murphy. This month, October, is Depression Awareness Month, so we're going to talk about that with Dr. Olayiwola when we come back, so stay with us. Welcome back to For the Record. I'm Sean Murphy. Again, October is Depression Awareness Month, and it affects a lot of people. We'll find out how many in a sec. Our special guest today, Dr. Olayiwola, is in to talk about it. First of all, I amazingly pronounced your name right.
Thank you very much.
And welcome to the show for the first time.
Thank you. It's a pleasure to be here.
Let's give people a sort of a basic definition of what depression is and the different kinds.
So depression is a situation in which a person feels mentally they don't feel like they're able to do what they're normally able to do. They're sad, they feel hopeless, they feel down and out, and it can happen for a number of reasons. So in some cases it can be situational. So something happens, the loss of a loved one, the severance of a relationship, the loss of a job, something changes about your life, and you can become very sad and hopeless and down in the setting of that happening. But in other cases it's more biological, and there are certain chemicals in the brain that are thought to be the cause of that, where you have imbalances in the amount of serotonin or norepinephrine in the brain that leads to depression. So there are a number of reasons why this can happen. There are also hormonal reasons. Certain diseases and diagnoses manifest themselves with depression, and so there are many reasons why that can actually happen. But the end result is that people really feel like they're extremely sad. They're not able to do what they can normally do. They cannot function normally in society.
Now, it's a big enough problem where the medical industry and doctors such as yourself specialize strictly in this, right?
Yeah, and honestly, it's become something that's so important regardless of if you've decided to specialize. I'm a family physician. I work for Community Health Center, Inc., which is a large primary care safety net institution. And really, honestly, it affects so many people, both the situational kind and the long-standing chronic depression, that regardless of if you're not a psychiatrist or a psychologist or someone that has focal training in that, you really have to get comfortable managing it.
And one of the questions that I wanted to ask is, why is it so important to talk about it and kind of get the word out? Why was it necessary to have an awareness month for this?
It's a lot easier to tell people that I have diabetes or I have high blood pressure.
A physical
disease,
yeah.
and people don't necessarily think that there's anything wrong with that. They feel like, well, you can get managed and that's okay. But
get over it.
To talk about mental illness it's very stigmatizing. There's a lot of, anytime you hear, and a lot of the words that we use in popular culture without even thinking about it are linked to mental illness. So someone's crazy or someone's schizophrenic. A lot of times these are terms that are maybe medical terms that have become associated with very bad things, and so it's very hard for people to come out and admit to having mental illness.
Yeah, there's a stigma. The society doesn't accept depression as an acceptable explanation for what might be wrong with you.
Yeah,
right?
People say, well, just get over it.
Yeah,
get better, bounce back, get up, get out of bed, and they don't realize that in many cases people cannot do those things. And also we don't have a really good system of asking, and this is part of why this month is so important, is to make sure that people are not going to come forward and tell you. So we know that 1 out of every 10 adults in America has reported depression.
Right.
But that is, we know that it's definitely underreported because people don't just come out and say, I'm depressed. I mean, some people do, but it's not the standard thing that you hear from people unless you start to screen for it.
That's a good point. It's the one thing where people either are embarrassed to talk about it or just it's almost like a self-defeating prophecy in the sense where they're too depressed to be able to even want to talk to somebody about it. That they're depressed.
Absolutely. They're too depressed to want to talk about it. They're too depressed to even know that they're depressed. And a lot of times it's members of people's family, parents or friends or other loved ones that are the ones that usually start to notice the symptoms in someone before. And then and some people, they start to know these things like, I used to love going to the movies. I used to love going bowling. And all of a sudden I just can't do those things anymore. They don't necessarily realize that that's what it is. And that's why I think the role of the healthcare professionals is so important in helping people understand what they may be dealing with.
How is progress as far as medical advancement in that field as far as treating it going? Do you see advancement?
Absolutely. I mean, I think it's an area that continues to be under a lot of growth. There are medications that can help people. There are a whole host of behavioral therapies that don't require medication. There's, different techniques that psychologists and therapists really can engage in.
Natural ways.
Yeah,
right?
and natural ways to engage. So there's a whole, I would say, a whole portfolio of things that people can utilize to be able to tackle this problem, but they don't necessarily know about it.
Yeah. Now, clinical depression and things where there's a chemical imbalance. Obviously, you can, if you diagnose it, you sort of have an idea of how to treat it. But situational depression, when things occur in somebody's life, can that be? Can you help in that case with medicine or just with some certain techniques? Can that be helped too?
Yeah, definitely. And in fact, it's encouraged to try some of those techniques and those therapies in those periods, because there's no way to tell when someone goes through some kind of situational depression or grief situation how long it's going to last.
Right.
You can't predict. I mean, people that have had multiple cumulative problems happen in a short period of time tend to take longer to get out of some of those things, but really to be able to offer those services to people even in those situations is critical, and it's important.
The question I always had is, how can that be treated if their situation, whether it's the grieving of a lost one or end of a relationship, if that's in their head, so to speak, how do you treat that? Because the root cause of the problem still exists.
Yeah, so in some cases it's truly getting someone out of the situation. So someone's in a horrible domestic violence situation, and it's kind of perpetuating this cycle of depressive state. Certainly want to get them out of that situation, where to the extent that that's possible. A kid maybe being bullied at school, is having problems with a teacher or things like that. Maybe the depression is really a result of this situation. You try to get them out of that. But in some cases you cannot, or you should not. And in those cases, there are a lot of behavioral therapies and techniques that are useful to helping you deal with a situation or be able to change the perspective on a situation so that it doesn't necessarily lead to depression.
Let's talk about the different age groups. As time goes on and medical advances happen, are you discovering younger and younger people are diagnosed with depression, whether it be clinical or situational?
Absolutely. And one thing that's particularly important about depression is that it manifests itself in different ways depending on the age. So in adults, it usually shows up in a lot of things I talked about. I don't like to do things I normally did. I'm sad. I don't want to get out of bed. In children, it might be a little bit different. It could, show up in aggressive behavior. Maybe the grades start falling. Hostility towards the parents or towards the establishment. So it could show up in different ways.
Yeah, and depending, so I would imagine that the treatment would be different depending on the situation too, age-wise as well, right?
Yeah, certainly.
Now, when someone comes to you for the first time, obviously it might be difficult to actually get them to open up and talk about maybe what the problem is. Depending, they may not even be aware that it might be situational or clinical or some kind of chemical imbalance. Obviously, you do tests.
Yeah.
And so, how does the procedure go? What's the first things that happen?
So I'll tell you, one of the things that we have done at Community Health Center, we serve a large population of patients in the state of Connecticut, and a majority of our patients are from racial and ethnic minority groups and are in lower socioeconomic groups. And so when you talk about people identifying that they may have depression being very difficult, it's even more difficult in some of the minority and lower income communities. So what we have done, and it's been absolutely incredible and impressive, has been we've made depression screening part of our standard business. So if you come into our office for anything, so for all adults, for all adolescents ages 12 and up, and for all women who've had a baby for the entire first year of their baby's life. So we've said this is the standard of care. It's your height, your weight, your blood pressure, and a depression screen. And by making it something that we do for everybody, I'm not doing it for you because you seem like you might be depressed.
I'm doing this feeling about
you. I'm doing it for everybody. Or I'm doing it because you had a child, and it's possible to have this happen during postpartum. And by doing that and reducing the stigma associated with it, we've made it a standard part of our practice. We've really been able to see excellent results.
And you're not singling anybody out by doing everybody who comes in.
Exactly.
What kind of a test do you do to just determine sort of an initial?
Yeah, so there are a number of what we call validated screening tools that are available out there. There are a number. I don't probably not useful to go through all of those. But we use a very short, accepted patient health questionnaire. It's 2 questions. The first 2 questions it's 2 questions. And if you say yes to either one of those, then it prompts you to do a longer one, which is 9 questions. And based on the results and the answers to those questions, it will categorize, into mild depression, no depression, mild, moderate, and severe. And then you can you can start to make a plan based on what you get.
Will there come a point where you have to physically, do some sort of an exam or screening, to see if there's some sort of chemical imbalance or anything along those lines?
I'm not sure if that is in the works.
Necessary,
yeah, if it's even necessary.
Right.
In some cases, really, but the screening tools are pretty good, and those are just the 2 and the 9 question ones I talked about. There are a whole host of screening inventories that can really help you, better identify how severe the problem is and what you need to do with it.
As you learn more about depression in general, is there anything genetic involved with it, hereditary maybe? Is that possible?
We definitely know that depression runs in families, and mental illness, and for that case, other kinds of mental illness run in families. So there's no question there's a familial predisposition to it, and that's why, again, it's very important to screen early, because we've started to screen children at the age of 12 and say, and there are a host of things that you ask about as well, the family structure and any history of family mental illness or behavioral health illnesses in the family, and it's important.
Is depression curable?
So it is manageable. It's treatable and manageable. I would love to say, and patients ask me that all the time. So if I take this,
take this pill,
will it be gone?
Better.
Will it be gone? And it's an area where I would say that the jury is still not out yet. I mean, it's definitely treatable and manageable, and hopefully with good treatment and therapy and techniques, people can live very productive lives.
It makes me, because you mentioned diabetes earlier, it makes me think of diabetes in the sense that you can live with it, you can manage it, and you can live as normal a life as anybody else while still having it and being aware of it. And in the case of diabetes, watching what you're eating, making sure you exercise. And with depression, you can manage it and live at the very least as what someone would consider a somewhat normal life.
Sure.
Right?
And in some cases, I will just say there's sometimes depression results from certain medical things like thyroid disease or menopause, certain stages of people's lives, or other medical diagnoses can do it. So in those cases, if you treat the underlying cause, you can treat it. But you're exactly right. I mean, it's really thinking about, how do I live a full life with this diagnosis, and it's possible.
We're going to take a break and come back. Is there a website you want to give for people to go and learn more?
Yeah, www.chc1.com, Community Health Center, Inc.
All right, so go to the website, check it out. We'll take a break and come back and talk more about Depression Awareness Month, which is this month, with Dr. Olayiwola. I said it right?
Yeah.
We'll take a break and come back. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest today is Dr. Olayiwola. She's here to chat about October, which is Depression Awareness Month, and just being here on shows like this to get the word out. Do you think that there are other things that are going on in the month of October, as we all know? Is it not talked about enough in your opinion? Depression.
It's not talked about enough.
No.
It's not talked about in the communities. It's not talked about in the healthcare community.
Because again, there's that stigma behind it.
There is, and people tend to think that you could be able to, let's solve this in the family. Let's not let people know, and let's try to keep this between us. But I just read a fascinating, interesting, and very saddening article. The American Journal of Public Health just came out. Every year they do an analysis of the leading indicators of injury-based mortality, and for many years it's been motor vehicle crashes. And for the first time, this is just literally hot off the press, suicide has surpassed motor vehicle crashes as the #1 cause of injury-based mortality in this country.
And that's based on the depression.
On depression, and it really goes to show that, and I only half jokingly say that now it's actually safer to drive a car than it is to be depressed, and it's pretty scary.
Yeah, it really is, and especially when we learn more and more about it every day, and it's treatable.
It is. It is. Yeah.
And it's so sad that it comes to that the suicide rate goes up, and it's so treatable.
Yeah.
Even if and speaking of which, another reason why you're on the show is to talk about not only depression awareness, but also as it pertains to the healthcare field, because that's something where a very small percentage of healthcare is really involved or even acknowledges depression. I would imagine.
Absolutely. It's interesting. Having been a healthcare provider and also being a patient, I've been surprised and really amazed at what we've done, because I remember going to my OBGYN and having my 2 children and being pregnant and being postpartum, and no one ever asking me about postpartum depression. And so if they would have asked me, I would have thought, why are they asking me? What's that about? But the way we've made it really part of our practice has made it
so
really
everybody
gets it. But only 3% of primary care practices in the country actually screen for depression in a routine way. And so with us now, we're screening about over 70% of our adults are getting screened, over 40% of our adolescents are getting screened, and over 80% of our postpartum and mothers are getting screened for depression because we've made it part of our practice.
Are insurance companies more accepting of covering costs for anything involving depression these days?
That's one of the barriers, and we're it's one of the things that is very important as we reform healthcare, is really eliminating some of the costs and the barriers, the cost-based barriers to doing this. Establishing the reimbursement mechanism so that if people do take the time to screen for depression, that they will get reimbursed for it, or that it's built into a standard part of prevention services and screening care, so therefore it doesn't even require additional reimbursement. Those are the kind of things that are really, really important from the federal and the state level.
Right, and slow but steady progress. Now, without getting too political, as far as healthcare reform and things of that sort, does it matter depending on who the next president is, since we're in an election year, to determine like what happens out of your office as far as the amount of care given or how much emphasis is put on it, things like that?
Yeah, I mean, the current health reform bill it really does have a whole segment in there on integrating medical and mental health services, removing the barriers for screening, requiring and allowing for reimbursement for postpartum depression screening. Those things are actually all in there. One of the things that I think is most important and probably the biggest barrier, and it's really been tackled by the health reform bill, has been the pre-existing condition requirement, because that's one area where people that have had mental illness diagnoses in the past are very fearful of going to another insurance or trying to get a lower cost.
Because they think they're going to say no.
Right? And in many cases they will.
Yeah.
In many cases they will. If you say, I have depression, I've been treated for depression, I was admitted for depression, I almost committed suicide, you can almost guarantee that you're not going to get coverage. And so it's a lot of times why people don't want to mention those things anywhere, because they do it. So I think that lifting that barrier is a very big deal.
There's also that same stigma, like just maybe applying for a job. If you tell a potential employer of your history in that area, they might be more apt, whether it be consciously or not so much, to kind of avoid you at all, because maybe in their mind you could be a problem down the road.
And that's why it's so important, I think, for people to raise awareness in the communities, the healthcare community as well, because you can't if you see examples of people who have struggled with depression and who are being treated for depression and who are functioning and thriving, and and maybe they have some good days and some bad days, but they have a lot of good days. It's important to see that, so that you can say, I'm not going to prevent this person from coming into my work environment or being part of my space because they've had this, because I've seen people that have really functioned quite well.
Now, as a doctor who treats people with depression, you get people in all the time, and there's sort of a mindset where I'll take a pill and I'll be all better. Obviously that doesn't work that way. In a lot of cases, medication takes a very long amount of time to actually get the results that you want to. It's a very time-consuming process.
Certainly, with many of the antidepressants, there's a lead-in phase when you have to start off, and then you have to titrate and adjust the doses to get to a good place. In many cases, you have to switch medications. Maybe one's not working, or maybe it is working, but you're having certain side effects from it. So it is a process. But I would say that, and I would argue that it's important that it's just like diabetes, which is the example we've been talking about. Certainly there are medications, there's insulin, there are a number of oral pills that you can take for diabetes, but it does also require some other changes in the lifestyle.
What's your opinion of like over-the-counter things that are sort of naturopathic in a way, like sort of St. John's wort and things of that sort? Does it work? I mean, is it legitimate?
For some people, those things do work, and I certainly don't. If someone comes to me and says, I've used echinacea, or I've tried something, it's really been helping me and I feel better on it, then why would I stop them?
Right.
Why would I stop them?
Well, because the FDA doesn't approve it or hasn't approved it. And things
for the ones that are FDA approved, there are a number of natural remedies that have been FDA approved.
That make claims.
For people, they may not work for everybody, but nor do some of the mainstream medications work for everybody.
And a lot of things
either,
could be a placebo anyway, right?
Yeah.
So it's what they believe,
and
if
exactly.
it works for them.
Yep.
Now, at the same time, you're able to prescribe medication when someone needs it, but would you, in most cases, when possible, maybe sort of recommend natural things that people can do? Like things like exercising. When you go to the gym, you're kicking out some endorphins there, aren't you? And just to feel a little bit better about yourself for a while.
Absolutely.
Just one example.
Yep.
Or maybe you're a runner.
It's a great example. We in our organization, we have an integrated behavioral health system. So our medical and behavioral health providers collaborate to take care of our patients. In some cases, I can say as a family doctor, I don't really know if this particular medication is really going to do it by itself. I really need you to teach them some techniques, do some hypnosis, and I also recommend all those other things that you said. So exercise, yoga, stress reduction, mindfulness-based meditation. There are a number of other measures that you can put into the arsenal of things that can help patients.
And those are probably, good rules of thumb to do even if you weren't in a depressed state. It's just for the sake of healthy life.
Absolutely.
And if you are in this depressed state, that can only help you, at least temporarily, make you feel a little bit, because you do, come out of the gym, you do feel a little bit better for a little while, especially if you're making progress and you're going in the right direction.
Right.
It really kind of has a domino effect.
You're right. You're right.
And so recommend that. What else? What else can we talk about as far as Depression Awareness Month? What do you want to get the word out about?
I do want to just make sure that people understand, particularly for parents out there, I'm a mother, I have 2 young children, and I think it's very important for parents and for people who have children or who work with children, teachers, to also be able to understand the signs of depression in the children that they work with or take care of. Because, in some cases, if you can start to engage a child in care and early, you can really give them a long and productive life. So it's one of those areas that people don't necessarily think about. They may not think, they think my child is not doing well in school because he doesn't listen, right? Or my child's not doing well in school because
there's some other learning
there's
disability.
some other problem, and it may very well be depression. And so,
what do you say to someone who's watching today and they might be in a depressed state? How do you get that initial getting them off the couch to take action? What can they do?
Well,
the easiest thing they can do.
The easiest thing they can do is make a call to somebody that they trust that will help them get to where they can get help. The last thing that somebody that's depressed wants to do is sit on the couch and think about how depressed they are, because it really just perpetuates that cycle. Yeah. And many people sit there and go through those things. They do not realize that they can get help. And in many cases, you might not have the person that you feel like you're able to confide in. And so that's where the healthcare community really comes in. I mean, let us be the place where if you don't feel like you have the right friend or the right spouse or the right person to talk to about this thing, that there's someone that you can go to and talk to.
And conversely, if you are a friend, if you're a person who may not be the depressed person, but you know someone who is, you may think that they'll get mad, or it may not be your place to interfere. Yeah. But you're doing them a great disservice if you don't act.
If you don't, you don't. And like I told you about, suicide is real, and it's real in adolescence. I mean, we're not talking about just adults that are killing themselves. We're talking about children that are doing it too. So it's definitely a possibility. And you never want to be the person. I mean, I think this is probably extreme, but who wants to be that friend that noticed something in their friend didn't do anything?
Yeah, and then something
tragic happens.
It is Depression Awareness Month. That's why Dr. Olayiwola is on the show today. One more time on the website of your place.
www.chc1.com.
All right. Thanks so much for being on the show today.
Thank you for having me.
Come back anytime. That's our show for today. I'm Sean Murphy. This is For the Record. We'll see you next time. Take care.